it is incredibly difficult to continue having racial concordance when we recognize and realize that in this country, 5% of physicians are Black, 6% of physicians are Latinx, 1% or less of physicians are Indigenous or Native American. And so it becomes almost absolutely unrealistic for each and every one of us as Black people or as people of color to find a provider of color, or to not have a long waiting time, as was alluded to see this provider. So it's so important for our colleagues, our non-BIPOC colleagues, to have cultural competence is what I refer to it as, meaning that you have to be able to recognize what your biases are. So there's a lot of energy, there's a lot of conversation and a lot of respect and recognition that this makes a difference, that for every single patient here, we need to listen to you, but we need to take our cultural competency, which is just being aware of the racism that's been embedded in medicine, and elevate it to a cultural humility, which is when we hear your questions, when we're doing your exam and we see that protruding abdomen, instead of making a presumption, we say, hey, has anyone told you that this is your uterus right here? Oh, do you think this is normal? Instead of assuming or saying this is normal and leaving it at that, or instead of assuming that you don't want to do anything about your fibroids, asking, are your periods heavy? Are you having challenges with incontinence or bulkiness or pressure? And if not, great, we don't necessarily have to do something. But if so, why don't we do an ultrasound? And if it's something that's in the cavity, maybe that's why you've been having challenges getting pregnant all this time. So us asking questions, being vulnerable, that ability to go from cultural competence, anti-racism to cultural humility allows us to have better interactions with our patients. And I think that this is the time that people are realizing that it all is connected, but it's taken obviously a lot of wounds to get there, but I'm glad that we're there.